The anterior cruciate ligament, or ACL for short, is one of the most common ligaments to injure while practicing pivot sports. The most ordinary procedure to treat this is through a surgical ACL reconstruction, or ACL for short. However, after the surgery, the patient is prone to suffer a second ACL injury on either leg. This can happen even after the doctors clear the patients and authorize that they can return to practice sports. This occurs frequently since there aren't any measurements or rules that indicate when the injured athlete can return. In this project, a bilateral drop jump and two unilateral drop jumps were proposed to obtain the necessary parameters to quantify the recovery process and prevent another ACL injury. That drop jump is an exercise where the athlete must drop from a box and land on their feet. In this project, two boxes were utilized, where one measured 20 centimeters and the other 30 centimeters. This method required a total of 20 reflective biomarkers, where two were positioned in the iliac crest and another two were placed in front of this. A total of 4 pads with 4 biomarkers were used, where each leg had one of these in the gastrocnemius muscle and the other one on the vastus lateralis muscle. The 5 volunteers were healthy male athletes from different sports. The knees angle, hip inclination, and force were captured using the motion capture system Vicon and the force platform. After this, it was processed by MATLAB and Minitab. After this, we obtained the following results, where the force was calculated in newtons and the angles in degrees. The picture on the top part displays the results of the bilateral drop jump at 20 centimeters, and the one below represents the bilateral drop jump at 30 centimeters. The next pictures are for the unilateral right leg jump, where the picture on top represents the jump at 20 centimeters and the one at the bottom is at 30 centimeters. Finally, these pictures demonstrate the results for the unilateral left leg jump. The figure displayed in the upper part shows the results for the 20 centimeter jump, and the other one illustrates the results for the 30 centimeter jump. The results in the previous section show that there wasn't any notable difference on the bilateral jumps while changing the distance. This indicates that the athletes could easily overcome both distances, meaning that for a future project, it will be imperative to increase the maximum distance until the performance starts to decrease. Since this exercise has an overall better performance, the recovering athletes who just underwent an ACLR should start with this exercise, and if the results are adequate, they should move on to the unilateral jumps, starting with the healthy leg. As for the unilateral jumps, these showed very different results within the healthy athletes depending on each leg. For the most part, the jumps from the 20 cm box displayed more force and a worse technique. This happened because the athletes didn't have enough time to prepare for landing and couldn't get the form in time. As a result, the following step for this exercise will be to increase the distance to 30 cm and 40 cm. The calculated confidence interval of 80% isn't useful to adequately quantify the healing process of the patient and provide a more personalized rehabilitation routine. To correct this, it will be vital to establish more specific parameters like the sport practice by the evaluated subject. Once this is determined, the confidence interval can increase since the study will be more specific. In conclusion, these methods showed promising results. However, it must be modified in order to be validated as a tool to indicate if an athlete is ready to return to practicing their sport. Some of these changes will be applied to the height of the box and the sport of the athlete.